everyone is having a good week so far. This is Dr. Swati. I'm a gynecologist and a fetal medicine consultant here at Ankura. So what I do in a day is scan a lot of mummies and look at the babies there, and also scan a lot of women for a gynecology scan. So today's our topic is going to be PCOS and ultrasound findings in the PCOS. So where does the role of ultrasound come? Now, in a normal busy day, we see a significant percentage of women showing polycystic ovaries on a scan. So when we are doing a routine regular scan, we'll see women coming up with these polycystic findings. So are these all women who are having the polycystic ovaries, meaning ovaries which have got lots of tiny bubbles on them, fluid-filled bubbles on them, which are called as a follicle. So this is a typical description of a polycystic ovary. So are all these women who have the polycystic ovary appearance on the scan really having a polycystic syndrome? So let us try and answer that in the next 10 minutes or so. So what exactly is a polycystic ovarian syndrome? PCOS or polycystic ovarian syndrome is a condition which has got multiple representations. It's a syndrome. It's not exactly a disease. So there can be multiple aspects to that. Aspects related to the woman's fertility, aspects related to her menstruation, aspects related to her body image, because there can be a lot of hormonal changes which can lead to male pattern of hair distribution, etc. on the body. It can have implications on her, how she perceives her personality. So there can be a psychological angle to it as well. So there are so many different ways in which this PCOS may present. And there's no single blanket policy we can apply. Like we see a lot of women with who are obese and they are PCOS, but doesn't mean that all the obese women are PCOS or that the lean women cannot have the PCOS. So there is a admixture of lot of symptoms, etc. So world over, they have come up with protocols and guidelines where they say that we need to have or fulfill certain criteria to be labeling a mother, labeling a patient as a PCOS. And so there are 3 primary criteria and 2 of which should be fulfilled. So if 2 out of 3 are fulfilled in your case, then you can be labeled as a PCOS. So let us divide them, cluster-wise. So you may have symptoms related to menstrual problems. So there is a reduced ovulation in these women. That's why they are not having enough number of periods. What do we mean by enough number of periods? Ideally, women should menstruate between 25 to 35 days every cycle. Few days here and there is acceptable. But if you are having cycles where the gap is more than 35 days, or if we extrapolate it, less than 8 or 9 cycles in a year, then that will be classed as a reduced menstruation. So if you're not menstruating, then there are chances that you're not ovulating. Again, there are chances. There's no hard and fast rule here. So if you're menstruating, you're probably not ovulating. And if you're not ovulating, then you will not be able to conceive. So there is this series or this cluster of problems women may come to the hospital with, that they have menstrual disturbances right from the time that they started getting period, or something that has changed in the course of time, or they may be having trouble having a family. So this comes in the first category. So if either of these things is satisfied, then the first criteria is met. The second criteria is hormonal changes. So all these women have primarily hormonal disturbances at the bottom of the disease process, if we can call it. So there will be a derangement in the normal hormones which are produced in the ovaries. Normally, our ovaries are producing a minute amount of testosterone, which is a male hormone. And the presence of this male hormone is required for normal functioning also. But when that becomes excess, or there is an imbalance between the hormones, then it will start presenting in different ways. For example, these women may have some skin changes, which would be like the very oily skin, or having a lot of acne. Acne classically we're described as presence of these pimples. At least more than 10 pimples should be present for most years, for at least 3 consecutive years. Because we've all been there, I think, during the time of adolescence, and when changes are happening, a lot of people have these acne, but then they go away with time. But for us to categorize or to put a tick on this particular criteria, then the acne should be present for a long time, at least for 3 years. Then they have different patterns of hair growth. Usually heavily pigmented and coarse hair appear either on the beard area or below the chin, sometimes around the nipples, or sometimes in the midline in the lower part of the abdomen, upper parts of thighs. These are the areas where predominantly men have hair. So this kind of distribution and change in the hair growth or overgrowth of the hair could be seen. Contrary, some women may present with just hair loss. They are having hair loss from the scalp area. That's it. So weight gain and hair loss in the area. And then when you're actually doing the laboratory test, then there is an evidence, a biochemical evidence that there is an increase in testosterone. Now, which women are going to present how? It is very difficult to say. Women may have just few extra hair in the upper lip region, but they may still have disturbances in the testosterone levels. Therefore, lab tests will be required in these women. Also, we see that all these symptoms, especially with disturbed menstruation or because of the hormone derangement, can occur in multitude of conditions. So those need to be addressed as well and ruled out before we are labeling any person as having a PCOS. So for example, thyroid or other glands in the body like adrenal, or sometimes women may have insulin resistance, and which meaning body is producing insulin, but then the body is resistant to that insulin. Therefore, a lot of glucose is floating around in the circulation, and this increased glucose will have impact on the ovarian hormones as well. And therefore, the ovulation is affected and the women may have a trouble conceiving. All these kind of symptoms can occur. So this is the second category. And the third category, which is going to be the main talk today, is ultrasound changes. So if either of the three are met, then the women can be classified as a PCOS. So what are the ultrasound changes we'll be seeing? See, when the disease was first described decades ago, they saw a particular pattern in women who want to conceive or who are having trouble menstruation. And when they scanned this women, they found that the ovaries were really large. And the ovaries had a lot of these tiny follicles or bubbles, what we call them. So they labeled this as a polycystic ovarian syndrome. That's how the name came from. Poly meaning many, and cystic means all these tiny bubbles, what they described was cysts. But in course of time, our understanding of the disease has changed. We are able to pick up more and more hormonal changes, etc. Our understanding has changed, and therefore the definition has changed. And now, therefore, it's not mandatory for these women to have polycystic ovaries to be called as PCOS, because they may have other two features and they'll still be classified as PCOS. So that brings to my main part of the work, what I do. So mainly I do ultrasound all day. And what is an ultrasound? I want to address this because I keep getting asked this question very frequently, because these are all the women who are coming, especially for the gynecology scans. They are really worried that, you know, they want to conceive or they might be pregnant, and they feel we are exposing them to radiations. And that's why I want to make it clear that ultrasound, as the name is self-explanatory really. These are the sounds in a higher frequency range, that is above the range of a human ear to hear. So in this higher range of frequencies, the sound waves are produced by our transducers or the probes which we are using in the machine, and they are sent into the target organ or the area of the body which we want to scan. The sound waves, they come, they bounce back against this tissue. These are picked up by the probe again, represented as electrical signals, and then we see them in the form of images. So that is the basic principle for the ultrasound. So most women who visit a gynecologist will require an ultrasound of the pelvis or pelvic organs at some stage, whether or not they are suspecting PCOS or whether or not they want to rule out the other conditions. So this scan can be done in two ways. Your doctor will write either a transabdominal scan or an internal scan. So what happens in a transabdominal scan? In a transabdominal scan, we will ask you to fill your bladder, that is drink 1 or 2 glasses of water. You may have to wait because your bladder may not be full, but a full bladder is required for the assessment. And a transverse probe is a curved transverse broad probe is used and externally, and we are able to see the pelvic organs and comment upon that. The other method of doing it is by an internal scan, in which internal probe is inserted. So you will be asked to empty your bladder, and then a probe is inserted internally, because that gives a closer access to the organs and better viewing. So most of the time, whenever it is feasible, we apply the transvaginal approach. So a wand-like probe is put inside, and we take the images. So whichever method we are doing, basically we are trying to see the one and the same thing. So as we proceed with the scan, first thing what we try to see is the womb. How is the womb? How is the orientation? Sometimes it can be backwardly oriented. That may be adding to the other troubles. So normal, what is the normal orientation? Is it naturally how it is meant to be? Then we look at the size. We size the uterus, because multiple causes can be there, which are increasing the size of the uterus, some growth, some fibroids, etc. So those we want to rule out. We size the uterus. And in the context of PCOS, what mainly we want to look at is the endometrial thickness. So the wombs are having a lining, and this lining of the womb is called as the endometrium. So each time a woman is menstruating, every cycle, she is shedding down this endometrium. So if the periods are infrequent, if she is getting only say 3 or 4 periods in a year, or not even that, then our worry is that, is this endometrium really shedding, or is it just piling up and becoming thick? Because it has been seen that a small proportion of women where the endometrium is not regularly being shed can develop a thickening in endometrium and can develop some cancerous changes later. So we want to ensure that the endometrium is fine, although you're not getting periods, but the endometrium is measuring fine. So we'll definitely comment upon the endometrial thickness. And at the same time, we also rule out other causes which could be leading this menstrual problems. Then we come to the main organ which we are interested in, that is the ovaries. We look at both the ovaries. All of our scan machines are quite advanced, and we are able to size the ovary, not just linear size. What we measure is the volume of the ovary. And it has been noticed that the ovaries in women with typical PCOS are usually 2 to 5 times larger. So overall, the ovarian volume has increased because of all the hormonal disturbances which are occurring. What actually happens is, because of all these hormonal disturbances occurring, mature eggs are not being produced. So what is happening is, ovary is making a lot of these small bubbles, each containing an immature egg. So a small fluid-filled bubble with an immature egg, and many of them will be present in such ovaries. Whether they are 12 or 25, depends on which guideline and all we are following, or how advanced our machine is. So a fixed number is there above which we call them as increased follicles. So when these so many immature follicles are forming and they are not able to release egg because the egg is not really mature, they shrivel or they die in course of time. And what happens? All these get pent up or collected. So ovaries become increased in size. They become increased in their volume. And also the matter or the central part of the ovary starts looking really shiny in these women. And all the follicles which are now eventually falling are pushed mainly towards the periphery. So in the past, it used to be described as a pearl necklace appearance. It's not mandatory, but many of these ovaries will have a look of the follicles in the periphery and a shiny, thick center. And that also makes a thickness around the ovary because of all the changes that are happening and inability to ovulate, that the ovaries have a typical pearly white appearance. When we are doing the surgery, we see this kind of ovaries. It's important for us to comment on the ovaries other than just the number of the follicles and the size, about the texture as well, because when the gynecologists are planning further treatment, these things will need to be taken into account. We also look at the blood flow to the ovaries. And in many of women with PCOS, the blood flow will be increased. And then there are certain measurements which will be required if you were to go for the infertility treatment, etc. So this is what a basic ultrasound scan will say. And ideally, on the basis of a scan alone, we cannot label a mother, we cannot label a lady as a PCOS or a girl as a PCOS, because other criteria we don't know. We don't know the in-depth history, or we don't know the labs which have been done. Therefore, always in the scans, the reports, if you look back, you'll find the reports always say a polycystic appearance of ovaries. Because if the other two factors are not there, and it's just a polycystic appearance, that will prevent the person from being labeled as PCOS. Some burden of this title they'll carry forever. So we are very careful out there while we are reporting. There is another role for the ultrasound other than this is during the follow-up. So now we have given a baseline scan. We have seen what the endometrium is like, how big the ovaries are, how many follicles are there, what is the texture looking like, and is it like very bright pink? We have decided now we know endometrial thickness is not too much, so they will need to have few scans every now and then. And if you were to go for fertility monitoring or fertility treatment, then it's a whole different talk altogether, but we will be monitoring the follicles over there. So this is in a nutshell what we do in terms of ultrasound in helping in diagnosing and managing the polycystic ovarian syndrome. I hope I have answered some of the queries you might have had. If you still have any more queries, please feel free to type in your comments and we will get back to you. Have a good rest of the evening. Thank you.